Hi guys, welcome to Dogshala. So in this video, we are going to see about Myasthenia Gravis disease. So we'll see about the physiology, how it is caused, and also a few just about the clinical features of Myasthenia Gravis. So before going into the video, if you did not subscribe to our channel yet, please do subscribe. Please do follow us on our Instagram and Telegram handles for more updates. Let's just dive into the video now. Then introduction for this is that it is a long-term neuromuscular junction disease. So it is an NMG disease, that is neuromuscular junction disease, which causes skeletal muscle weaknesses of varying degrees. The most affected muscles are muscles involving like eyes, face, and the swallowing muscles like the pharynx and all. So it results in double vision, drooping eyelids, trouble in talking, trouble in walking. So the onset is sudden, and those affected will have a large thymus and develop a thymoma. So the pathophysiology behind this is, so as you all know, the neuromuscular junction is where the action potentials develop, which results in action of the muscles, right? So it causes it is this in this myasthenia gravis. What happens is antibodies are produced against the acetylcholine receptor. So acetylcholine receptor antibodies are produced. That is auto antibodies. The myasthenia gravis is something which is called as it itself destructs the body. It is an autoimmune disease which itself destructs the body. So these antibodies damage the postsynaptic membrane. So as you can see in this image, this is the postsynaptic membrane. These antibodies damage this postsynaptic membrane, which reduce the acetylcholine and voltage gated sodium channels. When this acetylcholine and voltage gated sodium channels are reduced, what happens is it prevents impulses from triggering the muscle contraction. These antibodies, they mainly block or destroy the nicotinic acetylcholine receptors. Okay, the acetylcholine receptors which are mainly blocked or destroyed in myasthenia gravis are nicotinic acetylcholine receptors. So which prevents the nerve impulses from triggering the muscle contraction. So the muscle activation is not happening in this disease. So because of this, there is skeletal muscle weakness in the uh, individual suffering from this disease. So other symptoms which are seen are ocular myasthenia or weakness of the eye muscles, drooping of one or both eyelids, blurred or double vision, change in facial expressions, difficulty in swallowing, shortness of breath, impaired speech, weakness in arms, hands, fingers, legs, and neck are also seen. Sometimes severe weakness may cause respiratory failure, which requires immediate emergency in the medical care. Okay. Then the epidemiology is it affects both females and males of all racial and ethnic groups. Most common in the young adult females under 40 and older males which who are over 60. Okay, it may this is most common, but it involves any age group. Childhood also it involves. So it is not inherited. It is not contagious. So it is rarely seen in infants. So if the fetus acquires antibodies from a female parent, it is called as neonatal myasthenia. It is rarely seen in infants, but if the fetus is acquiring the antibodies from his female parent, then it is known as neonatal myasthenia. It is generally temporary in nature, and the child symptoms usually disappear within 2 to 3 months after the birth. Okay. Then the diagnosis of this disease can be done by physical and neurological examination. So, and another important test is edrophonium test. Edrophonium test is used to test the eye muscle weakness. It uses the injections of edrophonium chloride. So, edrophonium chloride injections are done, which relieve the weakness. So, the drug blocks the breakdown of the acetylcholine temporarily, and increases the temporarily increases the levels of acetylcholine at the neuromuscular junction. Then blood test. The blood test is also performed where these individuals show abnormally elevated acetylcholine receptor antibodies. So a second antibody called as anti-musk antibody is also been found in half of the individuals with myasthenia gravis, which do not have the acetylcholine receptor antibody. In some individuals, these acetylcholine receptor antibodies are completely not there. Then this is called as seronegative or negative antibody myasthenia, because this individuals doesn't show any antibodies against the acetylcholine. So then they are called as seronegative myasthenia or antibody negative antibody myasthenia. Okay, then electrodiagnostics is also performed. Then diagnostic imaging, like imaging of chest using computer tomography and MRI may be taken to identify the presence of thymoma. Okay, if the thymus gland is enlarged or not, we can check with this. Then pulmonary function testing is done to evaluate the position of the respiratory muscles. Then, what is a myasthenia crisis? The myasthenic crisis is a medical emergency. It occurs when the muscles that control breathing weaken. So when the respiratory muscles weaken to the point where a ventilator is required to breathe. When the respiratory muscles are weakening to the point where the patient needs a ventilator to breathe. Okay, then that is called as myasthenic crisis. It may be triggered by infection, stress, surgery, or adverse reactions to medicines. Even if some medicine is causing this myasthenic crisis, we have to control the crisis and then continue treating the underlying condition. Okay, so approximately 15 to 20% of people with myasthenia gravis experience at least one crisis in their lifetime, and up to 50% have no obvious cause for this myasthenia crisis. Okay, then the treatment is, there is no cure. We have to treat the symptoms accordingly. Thymectomy for thymoma, and monoclonal antibody can also help in reducing the antibodies against the acetylcholine. Acetylcholinesterase medications such as mestinone and pyridostigmine may be used. Immunosuppressive drugs such as prednisone, azathioprine, mycophenolate mofetil, and tacrolimus can be used. Plasmapheresis and intravenous immunoglobulin can also be used in this myasthenia gravis to subside the symptoms experienced by the individual. So let's see the NEET MDS question. The myasthenia gravis is an autoimmune disease of NMJ which caused by antibodies that attack acetylcholine receptors. Which kind of acetylcholine receptors? Nicotinic acetylcholine receptors are affected in myasthenia gravis. Okay, so if you like our video, do subscribe to our YouTube channel. You can also follow us on Instagram, Telegram, and WhatsApp for further updates and information. Thank you.